Welcome to Global Mercy, the world's largest civilian hospital ship. My name is Rachel Rozier. I'm a Dutch television host and I'll be taking you on a tour today that you won't easily forget. But first, let's listen to the captain, Taylor Perez.
Hello, welcome to the Global Mercy, the world's largest civilian hospital ship. My name is Captain Taylor Perez, and it's my honor to welcome you. Thank you for being part of our journey. I hope you enjoy your Global Mercy experience.
The gangway, by the way, is pretty steep, so you might want to hold on to the handrail. And just imagine, soon lots of people, hundreds of people will walk here to access hope and healing and have their lives transformed. It's just an amazing thought.
Hello, ma'am. Good afternoon.
Hello, good afternoon.
How are you, ma'am?
I'm good, thank you.
Yeah, welcome on board, ma'am.
Thank you so much. I can just walk on?
Yes, ma'am. Sure, ma'am. Yeah.
Thank you.
Welcome on board, please. Yeah.
So, they have some very, very special guards here. They're called Gurkhas, and they're very fearsome Nepalese warriors that have been a part of the British Army for the past 200 years. And they have a very important task here, namely to keep the ship safe and secure. Okay, so right now it's time to enter the world of Mercy ships. She is in Europe right now for some final outfitting, but soon she will be serving in Africa. This ship is huge. Okay, I've got some numbers for you. The Global Mercy can house 641 people, including crew and medical staff. It can treat 950 patients. The onboard hospital alone covers 7,000 square meters. The hospital has 6 operating theaters, 102 acute care beds, 90 self-care beds, and 7 ICU isolation beds, plus state-of-the-art training facilities.
Welcome to the Global Mercy.
And welcome to Rotterdam, the starting point for our journey together. The Global Mercy is a life-transforming place where people who need it most can visit a doctor or surgeon. We are traveling to countries where many people do not have access to healthcare. We invite you on a journey to Africa. That's where the Global Mercy will sail to soon, and the Africa Mercy is already serving. In Africa, community is everything. For many people, having an untreated medical condition often means becoming an outcast and being rejected by their own community. Africa is thriving in many ways, but there is a lot of development still to be done in the provision of safe, timely and affordable surgery. Medical care is essential for people to thrive. Without access to safe surgery, even a simple and preventable illness can be life-threatening. Illness doesn't just affect one life, it leaves a mark on entire communities. Meet Clementine, who joined Mercy Ships 24 years ago to help bring safe and free surgery to people who need it most. Mercy Ships is a team, one big family, made up of supporters and volunteer professionals from all over the world, including local crew from the African host countries. Mercy Ships exists to make healthcare systems stronger and serve the patients that invite us to help. For these patients, surgery is not the finish line, it is the starting line for a transformed life filled with potential. Patients like Bernard, who was 7 years old when he was diagnosed with an aggressive tumor which couldn't be treated locally. Let's continue and hear his story.
This is our next stop. So, you just have to think about all these patients that will be treated here. Patients like Bernard.
I was born in May of 1998 with my twin brother Bernard. When he was born, it was just like a dark mark on his cheek, but as time passed, it started to grow. I remember my dad took him to several hospitals, and then they took him to this particular hospital where they diagnosed him of having neurofibromatosis type 1. People would always look at him like he was some abnormality, and I even remember this day we were coming home from school and we walked past a bunch of kids, and there was this particular girl. She looked at him and she pointed at him, and then she turned to her friends and she whispered something and all of them laughed, and I remember my heart just broke into like 1,000 pieces. I kept asking God why he made my brother the way he did, and I remember crying so much and asking God that I wanted that he should have the opportunity to get better, the opportunity not to look like that, so that people would not have to look at him the way they did. For us, hope was not really nearby. We were just waiting on God for a miracle. That was what we were waiting for.
When I heard about Mercy Ships from my dad and also my principal, because she was always concerned about me, and so we registered for the program and then got a call that was accepted. But as I was told that even though you get the appointment letter, it doesn't actually mean you're guaranteed to have the surgery. So just kept in prayers and faith that everything will work out well. So on the 19th of February, I came to the Hope Center. And the 21st, that's when I had my first screening. But then the surgeon wasn't there, so I had to come back the following week. So on the 5th of March, that's when the surgery was booked for. When I was told the surgery could be done, I was really, really happy. When I met the surgeon, I mean, the euphoria, I couldn't explain it, honestly. It was just really, really so much for me. Had the surgery then, I was really nervous that day. I never slept the whole night. When it came, Dr. Brad was my anesthesiologist. So they came and took me in and prepped me. So in the operating room, what I remember was they put the gas mask on my nose. I was just like, God, please let this go well, please let this go well.
It was a long, relatively complicated surgery, but having a good plan ahead of time and working with several teammates to keep an eye on things and keep on top of things was very helpful, and it went very well. It just, took longer than anticipated. It was a difficult dissection.
Oleg woke up on Tuesday, I think it was in the afternoon, and I was so dizzy. Could barely sit up, could barely stand. Then I saw the mirror and I was like, wow, he did a great job.
His recovery was so profound and relatively uneventful that he, I'm sure, is living a fairly normal life at this point in time.
That my brother had come out from surgery and he was recovering on the ship and doing fine. And seeing him come home to us and recover so quickly, be able to go to school and pursue his career, it's just been amazing. And I'm truly, truly, truly grateful to Mercy Ships.
Oh, I think it has to do with the fact that you can't let what people say about you stop you from doing what you want to do. So no matter what people say about me, I'm not going to let it stop me from going to school.
Wow, what a beautiful and hopeful story. And I think that Bernard's story is a perfect example of the effects that just one surgery can have on someone's life. And just think about the ripple effects that any of these surgeries provides. In 2021, Mercy Ships brought hope and healing by carrying out 3,138 surgical procedures, 16,067 dental treatments. They trained 1,343 locals through medical and dental courses and donated and delivered 930,260 PPE units. Well, this is the heart of transformation. This is the operating room.
You are now in the heart of the Global Mercy. This is one of the 6 operating theaters on board where countless transformations will take place. Meet one of our top volunteer surgeons, Mark Schreim. Let's hear what he has to say.
My name is Mark Schreim. I'm a head and neck cancer surgeon by training. I spend a lot of my time now doing research, teaching, and advocacy about the problem of access to surgery in resource-constrained settings. In the room right now, this room looks empty. But I'd like you to imagine that on a regular day, this room is full of people. It's full of surgeons, of anesthesiologists, of nurses, of instruments, of machines, all to take care of the one patient on the table in front of us. It's estimated that somewhere between 95 and 99% of the population of Africa can't access surgery. The tumors that we see in the maxillofacial and head and neck operating rooms are not of any different type than the tumors that we would see in the US or in Europe. They're exactly the same type of tumor, they're just a lot bigger. And that's because if I noticed a lump on my jaw, I would be in the doctor's office the next week. Whereas for many of these patients, it takes 20, 30 years before they can actually get access to care. In West Africa, we see a lot of jaw tumors that, again, would be treated in a dental office in the US or in Europe, but because of lack of access are allowed to grow so big that they obstruct the patient's airway, make it difficult for them to eat. So surgery itself requires an entire team. And part of what Mercy Ships does is train not just the surgeons in the countries in which we work, but come alongside and train nursing and train anesthesia, train biomed tech and sterilization, so that when we leave, hopefully we aren't just leaving some patients behind who have had some surgeries, but we've increased the capacity of the countries as well. There really is not a lot of difference between performing surgery on a Mercy Ship and performing surgery at a hospital in the United States. Very often, pretty much everything that we need in terms of sutures, in terms of technology, in terms of instrumentation, the same things that we would use in the US are available to us on the ship. Mercy Ships is really committed to providing the highest quality care possible to the patients that we serve. The hope really with Mercy Ships and with the work that we do, again, is not just to provide the surgery itself, but to start building up the infrastructure in the countries in which we work to start chipping away at that lack of access.
This way. So everything on this ship is made possible by the amazing Mercy Ships volunteer professionals. It's kind of like one big family. Okay, so here's some more numbers for you. More than 1,300 volunteers from over 50 countries work on board Mercy Ships every year. And of course, you're looking at surgeons and medical staff, but also the captain, cooks, sound technicians, teachers, electricians, and the list goes on. And I'd love for you to meet one of them and to show you a little bit around and tell you about life on board.
My name is Anna. I'm 34 years old and I'm from the United States, born and raised in the state of Nebraska. I live on board the Global Mercy here with my husband, Richard. I work in the finance department as the finance manager, and my husband works on the deck department. So I started with Mercy Ships in December of 2018 in Guinea, West Africa, and I've been with Mercy Ships ever since. Mercy Ships uses people from all different backgrounds and all professions. Living on a hospital ship in West Africa is like nothing I could have imagined. First of all, you live on a ship, which I come from the middle of the US, no water around. So that was a big change, and living and working somewhere where you know just a few decks below people are having surgeries that are changing their life. It's an experience you can't get anywhere else. I've met so many people from different cultures and different walks of life that have changed my life. My husband, it's something that it's hard to describe. I get to meet other people from Ghana, like my husband, so I get introduced to more of the culture and the cuisine, and Lawrence and his family have been a great way to learn more about Ghana and the culture that Richard has grown up in. So my husband and I met in 2018 when I joined the Africa Mercy in Guinea. We started dating on board and became engaged in the summer of 2020 and got married in August of 2021 in Ghana. And we were actually able to have several Mercy Ships crew members and alumni at our wedding, which was great. It was like we came from one community and had our family there as well. And we had the friends from Mercy Ships and then joined on board the Global Mercy immediately after the wedding. So this is our first home, and that's why our cabin is very important to me.
So the Global Mercy is not just a hospital, it's actually a home to a whole community. For example, there's a 682-seat auditorium, there's an academy for 125 students, but also a gymnasium, a pool, a cafe, a shop, there's even a library. So right now we're on our way down to deck 3, and over there we are going to listen to our hospital chaplain, Clementine. And Clementine is going to introduce some key projects that have left a lasting legacy, a big impact, thanks to the great efforts made by both host nations and also supporters. Mercy Ships runs medical capacity building programs, so they train medical professionals in Africa. And what this does, it creates this invaluable opportunity to work together with our African host nations and leave them even stronger. So right now we're at the OR Simulation Lab. This is going to be an audio tour, so I'm going to put on my headphones and enjoy the tour.
Hi, my name is Clementine, born and raised in Ghana. I joined Mercy Ships 24 years ago, and since then, I have volunteered with Mercy Ships in many countries across Africa. And I can say Mercy Ships is all about building community in a beautiful continent of Africa. Please join our journey.
Together with Africa, Mercy Ships medical capacity building programs bring an invaluable opportunity to work together with Africa. African Bureau Director Dr. M. Pele says the pandemic demonstrated that we need to support Africa to strengthen healthcare systems. We now have a ship with all the facilities to not only provide free surgeries, but to focus on capacity building and bring African colleagues to do surgery on board. We work as a team. Healthcare Heroes, Gamal Dental Clinic. As a boy, Francois watched his mother suffer from untreated tooth pain for years. It made him determined to become a dentist. In 2018, he enrolled in Gamal University's dental program in Guinea. When Mercy Ships partnered with the university, they could renovate the dental clinic, provide simulation equipment, and arrange professional mentoring. Francois is now enjoying a great education. Excited to help shape the future of Guinea's dental care system, he is starting with his own community. Food for Life transforms communities. Good health isn't just about receiving surgery when you need it. It's also about building healthy habits and preventing issues from beginning. That's where the Mercy Ships Food for Life program comes in. Through agricultural training and nutrition education, students like Birima can rebuild, restore, and renew their lands and communities. Students can take business classes, giving them the tools to launch their own business, selling sustainable crops. Sounds from Africa. At the heart of every African celebration, there's music. Let's enjoy some crew favorites from the countries Mercy Ships serves. Healthcare Heroes, Abraham Wodome. After a chance encounter with a Mercy Ships eye surgeon in 2010, Dr. Abraham Wodome joined Mercy Ships' Ophthalmic Surgical Training Program. Dr. Wodome is now Togo's leading ophthalmic surgeon, and by 2017, Dr. Wodome's annual cataract surgeries represented almost half of Togo's total ophthalmic surgeries. He has shared the legacy of training many ophthalmologists across Togo and Benin.
So now we've seen the impact, we heard about the legacy of the work over the past 40 years. So now it's time to meet Don and Dion Stevens, because they founded Mercy Ships in 1978. So let's hear about this dream that wouldn't die.
Welcome to the Global Mercy. Someday, I don't know when it is, but the possibility that every hospital bed, every ward bed, whether it's acute care, long-term care, will be filled either with patients in one stage of recovery or those that are awaiting their life-transforming surgery. What a privilege it is to welcome you, to be a part of this dream that wouldn't die.
It started with an idea that many things in life had contributed to, but then I think was really clarified and magnified by Don's encounter with Mother Teresa.
When I saw what Mother Teresa was doing, I was asking myself, why am I born? And she actually asked me, why were you born? What's your purpose? Why did God put you here? That's a question for you. Because I told Mother Teresa that I thought I was born to help develop, deploy, secure a hospital ship to serve Africa. And she didn't laugh at me, but she said, that's a big dream, something like this. This is 45 years ago, 44 years ago.
We never imagined what we have now. It was never even in the realm of imagination. I came for a few months and then kept staying. But I also, while we were in the midst, was figuring out how to be a mother, how to be more of a family. Wonderful place to rear children. Absolutely marvelous. School was wonderful. Volunteering has its important part here, and it's not only for the work of the ship and its outreach, but it's the work of the individual who every day persists and perseveres in doing good. The living on board changed me, as well as the people that we were supposedly ministering to. And I think that happens to our volunteers very often.
The changing of individual lives is powerful, every single one. What are you doing about your dream, your purpose, while you're here on earth?
Wow, what an amazing story. And just to think that all of this started with just 2 people who had a dream, and they made a huge mark on the world. So the question is, how will I make my mark on the world? And how will you make your mark on the world? Thank you so much for joining me on this very special tour. For now, I'm going to pass you back to your tour host to answer any questions that you may still have. For now, maybe we'll see you in Africa.